Hi, my name's Hannah. I'm 20 years old. I live in London and I'm at university training to be a paramedic. I've lived with epilepsy for about 6 years now and I've been in control of my seizures for around 2 years. At the moment, I don't feel a risk of SUDEP, but when I was younger, before I learned more about epilepsy, SUDEP was something that really quite scared me. I think it's very important for everyone to learn about the risks of SUDEP, whether they suffer from seizures or not. We need to bring awareness to epilepsy risks in order to reduce the number of deaths from epilepsy. I had my first seizure on my 14th birthday. It came out of the blue. I collapsed and had a grand mal seizure at the breakfast table. I had a few more seizures and then my doctor confirmed that I have epilepsy. Since then, I've had about 20 more seizures. I tried many types of medication throughout my teenage years. Every time that I switched medications or increased my dose, I thought that I'd finally had my epilepsy under control, but then I'd have another seizure and then I'd be back to square one. I felt that my epilepsy was limiting me compared to my friends. They were growing up and being independent and learning to drive, and I couldn't even swim unsupervised. None of my family or friends had experienced what I was going through, and I felt like I couldn't ask anyone for advice. My parents struggled to reassure me when they themselves didn't really understand what was going wrong, and my seizures were completely out of their control too. I felt embarrassed that I had epilepsy, and I didn't like to tell people that I had it because they thought that they would treat me differently if they found out. But this was dangerous because I ended up having a seizure in front of a lot of my friends, and none of them even knew that I had epilepsy. For a long time, I felt like I wasn't in control of my own life. I felt that epilepsy was controlling me. I didn't have any peers who I could go to for advice, so I felt like I was quite alone. I didn't know that SUDEP existed for a long time after I'd been diagnosed with epilepsy. Maybe my doctors had told me about it in the beginning and I'd just forgotten. Or maybe they didn't tell me because they didn't want to scare me. I was only 14 at the time. My risk of death was low. However, in 2019, one of my favourite childhood actors passed away suddenly. His cause of death wasn't initially reported, so I researched a little bit and found out that he had a seizure in his sleep and passed away. And it was an unexpected death. This was the first time that I remember learning about SUDEP. I felt shocked and uneasy, and I was initially scared that I could die at any second from a seizure. At this time, my seizures were uncontrolled, so I spent a lot of time worrying, like, what will happen if I have a seizure at this moment. Sometimes I stayed up at night because I didn't want to go to sleep in case I wouldn't wake up. Eventually, I wrote a list of all the risk factors for SUDEP down on one side of a piece of paper, and I tallied up whether I thought they applied to me or not to try and work out my own risk. I thought that doing this would make me less stressed about my SUDEP, but I still hadn't talked to any of my epilepsy specialists or anyone really about how I felt, so it didn't reassure me at all. My dad found the slip of paper, and then the next time we went to a doctor's appointment, he encouraged me to talk to them about how I felt. They tried to reassure me that my risk for SUDEP was low, especially because of the type of epilepsy that I have. And I've since learned about many SUDEP resources that are available through doctors and online that are much better than my tally system. But at the time, I didn't benefit from them because conversations about SUDEP were rare. For me, and anyway, they were non-existent. I think it's important for people with epilepsy to know about the risks of SUDEP because I don't want anyone to be in the same position that I was in. I don't want anyone to be stressing about something that might not even affect them. I think it's also important for people to understand that there are simple lifestyle changes that they can make that will reduce their chances of SUDEP. Now I feel that my questions to do with SUDEP are answered, and if I ever have anything else that I want to ask, I know where to go to access resources and information, and I feel comfortable talking to my specialists about things. I want people to know that sudden unexpected death in epilepsy is real, and it can be scary. It's definitely scared me. But talking to people, especially health professionals, makes it a lot less intimidating. If you want advice, just ask for it, because help is out there, especially from people who know what they're talking about. So, as I said, I'm currently training to be a paramedic at the moment. I'm really enjoying it. I'm in my second year at university. And I think the time that I spent with clinicians and in hospital throughout my teenage years, it definitely had an impact, and it definitely encouraged me to go into healthcare. I enjoy being able to help people in the same way that I received care when I was younger.